As an active person, athlete, or even weekend warrior, you've probably dealt with a sports injury in the past, or you're concerned that you may in the future. And so I want to discuss sports injuries to you. And there's really two categories that you could potentially deal with. One is a traumatic sports injury, like a sprained ankle or a knee injury, or the other is an overuse strain or an overuse sports injury. Those are the most common ones we see in our practice, where an active person is repetitively doing a sport or activity and they deal with an injury. Muscle strains, tendon pulls, tendinitises, there's a lot of different types of sports injuries that you could deal with. We really try to figure out not only what the injury is, but also the timeline of recovery. Is it a red flag where we need to refer you out, or can we treat you in-house here and get you back to your sport quickly? We try to avoid long periods of rest. We want to get you back to your activity and sport. And what's great about what we do with a lot of our treatments is we can do that. And so the sports injuries that we deal with a lot in our office can heal rather quickly. We typically, set people up 2 times a week for 3 or 4 weeks after we've got a really good working diagnosis and give you a return to sport timeline. And we also want to figure out, why did it happen, right? If you get an overuse knee pain from running, is there a foot and ankle issue? Is there a hip issue? And so we're going to do a full assessment, a full functional assessment to figure out why this is happening. And that's going to help guide us into the treatment. And before we dive into what we would do for that, I want to go over a really short diagram here, a little screen share on how overuse injury strains occur, so you can understand it conceptually and then implement things in your everyday life to help prevent it. So here is my little diagram of the overuse repetitive cycle. Here's a quick diagram overview of the cumulative injury cycle, and this is how overuse injuries in sports happen. Typically, it starts with overwork, right? We can agree that a lot of sport and activities is overwork to the body, and when that happens over time, that's not so bad that it causes a traumatic injury, but just a subtle overwork consistently. It'll actually lead to weak and tight muscles in your body. Every muscle in your body either tends to become weak or it tends to become tight. For instance, the glutes tend to become weak, the abdominals tend to become weak, the hamstrings tend to become tight, the calves tight, right? So every muscle will fall into that category once there's overwork happening, and you end up with a muscular imbalance. And when the muscular imbalance happens, it'll lead to friction, pressure, and tension in an area. So example, in the neck, you get a lot of tension in that upper trapezius. Always feel like those trigger points in that area, because most likely you've had a muscular balance in the upper back, shoulders, neck area, leading to tension in that. Another example is we end up with weak hip muscles that aren't stabilizing the hip well, and ends up undue stress and friction of a tendon around the knee that happens. And so ultimately you're leading to this friction, pressure, and tension in certain areas of the body, and it'll lay dormant for a while. And what ends up happening to that area, once it's become dysfunctional to a point, you'll end up with a decreased oxygen to the area. Decreased blood flow and oxygen to that area will then lead to scar tissue, okay? And so we've all heard of trigger points and maybe even scar tissue. This is where a muscle, tendon, or ligament over time that's dealing with a muscular imbalance that's causing friction, pressure, and tension, and a decrease in oxygen to the area will now lead to the formation of scar tissue. And if that muscle, tendon, or ligament deals with this scar tissue for too long, it actually makes it become weaker and tighter. For instance, if your hamstring is riddled with some scar tissue because of overuse, that hamstring is going to get even tighter. And so that can happen in a lot of different scenarios and a lot of different muscles, but this cycle perpetuates itself over and over again, and it lays dormant for a while until finally the straw that breaks the camel's back, and the body sends off the alarm system, which is pain. And that's when you end up with the injury or pain and you come to our office, right? And that's what happens a lot in overuse sports injuries. When you come to our office with a sports injury, we start with the scar tissue and really try to break that up in a lot of ways and release a lot of the tightnesses and trigger points and scar tissue, get some blood flow, which then carries the oxygen to the area, which helps with the healing. That will then decrease the friction, pressure, and tension on the area. And through some sports rehab exercises as well, we can work on correcting the muscular imbalances, right? From an injury prevention standpoint, we would love for you to start working here and working on some corrective exercises to improve any muscular imbalances that you have. And that is how we can really stave off injuries. And this is the cumulative injury cycle. It's a silent process for a very long time. And then it gets you. And the alarm system comes off, which is the pain and inflammation. And now we got to get rid of that. Now that you've seen how these overuse injuries occur, typically if you have the pain happening now and we evaluate you, we need to target at getting some blood flow to the area, getting the pain to go away, decrease the inflammation in the area, and then work on building some muscular balance. And that's why in our practice we do equal parts joint manipulation if needed, muscle therapy, and corrective exercises to really get you back to where you want to. Our goal for you is to become injury resistant. And injury resistance to us means we're going to decrease the chances of the injury reoccurring. We can't fully prevent injuries. It just happens, right? But we can really decrease the chances of it. We can decrease the severity of an injury if it does happen, and we can increase the recovery time if you do get hurt, which is great news. And so our goal when you go through a treatment plan here is to become injury resistant. And so a typical treatment plan is going to look like 3 phases. Phase 1 is to get you out of pain. Phase 2 is a return to normal activities of daily living and just kind of life. And then phase 3 is full return to sport with optimal performance, right? Because that's a big thing we see is someone can get back to their sport, but we really need to also bridge the gap between being able to play and being able to play at your best. And that's why you really want to make sure you get optimal care for this. And then you want to do the at-home rehab program as well to keep that injury resistance and optimal performance in everyday sport and life. So now that you understand sports injuries a little bit more, I want to show you real quickly some of the evaluations and treatments that we do for sports injuries. And then from there, you can get really an understanding of why sports injuries don't have to be a chronic issue in your life. But let's assume we're dealing with plantar fasciitis. A lot of times we're going to have pain right here where it inserts, but it could also span the entire foot. And so we're going to make sure that we evaluate that whole process. One of the things that we do during our evaluation process is to check the motion of the ankle to see if there's flexibility in the calf and the ankle joint itself. And so we'll do some active release technique in there, but we'll also do something called Graston technique, which is a stainless steel tool that's got a beveled edge. And I'm going to use a little bit of an emollient in there. And I'm going to really try to release this calf because as I mentioned, that Achilles gets tight, it pulls that way, it pulls the plantar fascia, tug, and it just gets real tight right there. So I'm going to get in there, and as I'm doing this, I'm going to get him into some ankle motions and try to really loosen that up. With a lot of our plantar fasciitis cases, we like to use deep tissue laser therapy. Laser therapy or class 4 laser therapy has been shown to really help stimulate the healing process. Every cell in your body has the ability to heal and turn over and replicate, but sometimes it loses that tug of war battle with the stress placed on it. And so the laser actually stimulates that cell to heal at a faster rate. And so we're going to get in to the areas of a lot of foot issues, elbow, wrist, shoulder. And so on plantar fasciitis, we're going to get right on that attachment. And we'll spend about 3 or 4 minutes on the complete foot and ankle during a plantar fasciitis case. I'm going to show you a couple stretches and an exercise for plantar fasciitis that you can do at home by yourself, very safe. These are beginner level exercises. In our office, we tend to get to intermediate and advanced, but I don't know your particular situation, so I can't give you advanced exercises. But the ones I'm going to give you today can be really helpful in preventing foot pain or help managing the moderate foot pain that you may have now. And so first one's just going to be a nice foot stretch. You're just going to cross over the affected leg there. You're going to take your, say in this situation, your left hand and hold that. Then what you're going to do is try to just grab the toe and the ball of the foot there, and you'll just pull with a nice stretch just like that. And so I'm getting a good stretch right along that plantar fascia, and my ankle is dorsiflexing that way, and I'm getting a stretch on my calf Achilles area. So hold my heel there, and then just a nice stretch. You can hold that for about 10 to 12 seconds. Do both feet, and you can do a few sets. And you can do that a few times a day, in particular when you wake up in the morning, which is a common time where the foot will be more painful and a little more stiff. If you'd like to get your sports injury evaluated and treated on the same day, call our office at 561-997-8898 or visit us at www.healthfitchiro.com, and we'll get you on our schedule and get you on the road to recovery.